People who communicate effectively with their doctors and other healthcare professionals tend to enjoy better health than people who do not. Effective communication requires active participation in one's own health care. Active participation includes learning about healthcare issues, visiting a doctor regularly, obtaining appropriate preventive care, and remaining observant for signs of ill health or bodily changes, such as a change in the color of a mole or detection of a lump in the breast or testicle. Active participation also means monitoring one's health in the case of a specific disease. For example, a person with hypertension would regularly monitor blood pressure. A person with diabetes would regularly check blood pressure level. A primary care doctor should be the counterpoint into the healthcare system. Having a primary care doctor has many advantages and usually leads to better ones. People who do not have a primary care doctor are more likely to inappropriately seek help in a hospital emergency department or to be seen by a doctor they do not know. In such case, medical information that could be important to the treatment of the problem is often forgotten or unknown. Communication is often better and medical decisions are more easily made when an established relationship exists with a primary care doctor. People are more likely to trust doctors they know and in turn are likely to experience less anxiety when a medical problem arises. Additionally, doctors who are familiar with their patients are less likely to make mistakes and more likely to provide better health care at lower cost. Primary care doctors often have long-standing relationships with their patients and are familiar with their wishes, the manner in which their patients best receive information, how they cope with adversity, their ability to purchase prescribed drugs, and which family members they rely on. Generally, everyone should routinely visit their doctor, dentist, and eye care professional, for example, an optometrist or an ophthalmologist, if applicable, for preventive care. The primary care doctor should provide a schedule of what type of care is required, why it is necessary, and how often visits should be scheduled. In general, preventive visits are needed most frequently in infancy and in later life, but the recommended frequency varies depending on personal risk factors. For example, a person with genetic risk factors for a particular disease may need to have more frequent checkups. Between preventive visits, people may experience a variety of symptoms that require medical care. Many symptoms and problems, however, can be handled at home without visiting the primary care doctor. For example, most routine colds do not require the attention of a doctor. Over-the-counter cold medicine care can be used to relieve symptoms, and ibuprofen or acetaminophen can be used to reduce fever. Most small cuts and abrasions can be handled by first cleaning with a mild soap and water and then applying an antibiotic ointment and a protective covering. When unsure about the need for medical attention, a person can call the primary care doctor to clarify the urgency of the problem and determine whether a doctor's visit is required. Some doctors offer email access for non-emergency questions. Others prefer contact by phone. In general, true emergencies should be handled by calling the local emergency service to provide ambulance service to the nearest hospital. However, deciding what qualifies as an emergency is sometimes difficult. Good judgment is often required, and under some insurance plans, a doctor's permission to visit an emergency department is required unless the situation is life-threatening. Preparing for the healthcare visit allows a person to get the most out of time spent with a doctor. During a first visit, The person may wish to inform the doctor of any personal, religious, or ethnic considerations that might affect his health care decisions. If the person already has an advance directive, such as a living will or a durable power of attorney agreement, a copy for the doctor's records should be made. If the person does not already have an advance directive, he may wish to discuss reasons for having one and how to proceed in planning to prepare one. Also, the person should ask questions